Welcome, parents. You are watching the first part of the series on supporting your anxious child, tools for supporting your student. My name is Elise Greenaway, and I am a licensed clinical social worker, and I am currently working for the Pleasanton Unified School District. And I've given this presentation a few times at different parent universities or parent nights and wanted to make it available to all parents online. So, a brief overview of what we'll be covering today. We're going to just start by talking about what is anxiety, how does it work, what relationship it has with other issues, the causes, how to know if your specific child needs extra support, and then some practical tools on how you can help your child at home. So I hope that this is a really good use of your time and that you walk away feeling like you have tangible things that you can do to support your child. Before we go any further, I want to just start off by sharing the prevalence of anxiety. Research shows that 1 in 5 children and adolescents are going to struggle with anxiety. So this is a really prevalent issue, and this is why we've specifically designed this training. We see it's affecting a lot of students in our district. What is anxiety? I always like to start off by explaining that anxiety is both natural and necessary. So what I mean by that is that everyone experiences some sense of anxiety in their everyday lives. This is a normal thing, and it's actually necessary. If you think about the concept of a car barreling towards you at 50 miles an hour, you want to feel a sense of anxiety because that anxiety is going to prompt you to move out of the way. Similarly, we see this with a big test that's coming up. If there's a test that you're wanting to pass, it's healthy to have a little bit of anxiety surrounding it because it's going to prompt you to focus and study for that exam. We also know that anxiety can be based on real or imagined circumstances. So a student might have anxiety about failing a test because they've previously failed a test, or they might have anxiety about a test and failing it even if they have never failed a test before. We also know that anxiety has neurobiological underpinnings, and so we'll get a little bit more into that later, but it is something that is not always explained by circumstances in your life. Sometimes people experience anxiety and they don't exactly know what to pin it on, and so they start searching for things to pin it on. And then lastly, we talk about how anxiety can be a signal or a noise. So like we said, sometimes it's helpful because it prompts you to take action, and other times it's just a distraction. So anxiety is good when it comes to a test because it prompts us to study for the test, but if it gets to the point where we are so anxious and stressed out that we can't focus, this is when it becomes a problem. How does anxiety work? It's kind of a circular pattern. Often the way we think turns into one big worry, which then leads us to practice avoidance. And so we kind of keep going around and around in this circular pattern. A lot of parents ask, how does it actually feel for my child when they're anxious? What we know is that there's some kind of stressor, and like we talked about, this can be a real or imagined circumstance. And then in response, our body prepares for fight or flight. And so some of the very real symptoms that our students experience are things like shortness of breath, tight chest, dizziness, heart palpitations, muscle pain, wanting to go to the bathroom, shakiness, sweating, dry mouth, difficulty swallowing, blurred vision, butterflies, and nausea. We talk often about how anxiety is developmental, and so we want to bring to your attention that anxiety is a normal developmental pattern. So when you look at a baby between 7 to 9 months, a lot of babies start experiencing stranger danger, where even if mom is there, they don't necessarily want to be held by someone else. This is normal. 12 to 18 months, we start seeing separation anxiety when babies become aware of the fact that their caregiver is leaving the room, and so they start to get anxious about that. Again, that's very normal. And once kids hit the age of 8, their anxiety can become a little bit more abstract because their brains are capable of having abstract thought. What we want to be aware of is when anxiety is not appropriate for the developmental level. So if we have, 12 to 18 months, it's normal for children to experience separation anxiety. But if you have a child that is maybe 13 and still experiencing that separation anxiety, if there was no trauma or background of an incident happening, this might be a red flag to see that, okay, this is not normal anxiety for their developmental level. We also hear the words stress, worried, anxiety disorder thrown around a lot. And so I just want to clarify the difference between those things. We talked at the very beginning about the fact that everyone experiences some degree of stress and worry in their lives, but when does it become an actual disorder? The disorder happens when anxiety becomes excessive beyond what is expected for the circumstances and child's developmental level and results in problems in school, personal, and academic functioning. So I used the example earlier of a 13-year-old that maybe wouldn't want to go to school because they're so anxious about leaving their parent. There's a lot of relationships between anxiety and other issues that can arise if the anxiety is not treated. Substance use is a huge thing that we see. A lot of times students are feeling really anxious and they start to believe the lie that if they smoke weed, that's going to decrease their anxiety. Research shows that it's actually the opposite, because once that high wears off, the anxiety is still there, and a lot of times it has the opposite effect and actually makes students more anxious. So we really emphasize helping your student to learn to deal with anxiety, because a lot of times when students don't learn to cope with their anxiety, they start turning to things like substances, and we call that self-medication. ADHD is also typically related. A lot of times we see people misperceive symptoms of anxiety and they assume that it's ADHD, and so they start treating the ADHD rather than the anxiety. We also see increased blood pressure and heart issues, depression. A lot of times when students are just really struggling with anxiety, they start to feel depressed because it's really hard for them to live their lives with this degree of anxiety. And then obviously things like school performance are interrupted. There's no one straight cause for anxiety, but there are some causal factors. We can look at biological and environmental. So when it comes to biological, we do know from research that genetics play a big part. Again, I like to emphasize that just because a parent is anxious does not mean that their child is going to struggle with an anxiety disorder, but we do see a common link between these very often. Medical factors can also definitely influence anxiety, and then deregulation of brain chemistry. So sometimes there's no circumstances or events that have happened to really cause anxiety for a child or a student, but there's just something in the brain chemistry that's kind of out of whack and unbalanced, and we see medication being really helpful in those situations because it really helps to balance out the chemicals. As far as environmental, we do see that parenting really does impact a child's degree of anxiety. So if a parent is constantly uptight and anxious and worried about things, we see a huge correlation between that and anxious students. Cultural norms. So in some cultures, different things are stressed more than others. Long-term stress, change, which is really hard. Our students experience a lot of change, especially in the middle school and high school years. And then things like abuse, neglect, and trauma we see often tied to anxiety. A lot of parents struggle with knowing when it becomes an issue for their child and when do they need to get help. We really want to remove the stigma, and this is a big reason that we have this training as well, and just communicating that it is not a bad thing if your child is going to therapy. It's not a bad thing if you're seeking outside support for your child. This is a really positive thing and a great way to support your child. As we talked about before, untreated anxiety can have a lot of risks, and so we really want to encourage people to get their child the support they need. The goal of intervention with anxiety is to help your child to be able to function in everyday life. So some questions you might ask yourself are, one, is the anxiety typical for a child of this age? So we talked about before, developmentally, it's appropriate for kids to experience anxiety, but we want to look at, are they still experiencing separation anxiety at an older age? Things like that. Two, is the anxiety shown in a specific situation or is it more pervasive? So sometimes we see students struggle with school anxiety or anxiety with a certain sport, things like that. Three, is the problem long-term or recent? Four, what events may be contributing to the problems? And then five, how are personal, social, and academic development affected? We're going to continue on in our next section, How Can I Help My Child at Home? So if you return to the original hyperlink document, you can click to this next video.